military student in medicine will join a great family, a great team. I'm Major General Pierre Nerings. I'm the Surgeon General, that is the head of the medical military service of the Belgian Defense. The medical component is one of the four main forces in the Belgian Defense. Beside land, air, navy, we have medical. We are responsible for several aspects. First of all, the medical support to operations. That means that we are organizing healthcare, but also surveillance of the health status of the force deployed. Our second main issue is to be sure that we are prepared to go to operations. That means that we have to organize, let's say, vaccination campaign, preventive medicines for the troops who will deploy. And we are also responsible to organize this humanitarian help. It all depends the situation, it all depends the status of the conflict, if we are going into conflict or if we are organizing our medical support to the humanitarian mission as such. Our third main orientation is to be sure that people are completely protected against diseases, and that's the reason why we have to develop travel medicine, that we have to prevent disease instead of curing diseases, but to be able to cure them if needed. And that's the reason why we also have to deal with the four main focus, which is occupational medicine and also expertise medicine, where you will have to define which military need to be re-affected in another function, in another posting, just in order to allow him or to allow her to reintegrate after disease, after being wounded in conflict zones. And the last one, and not the least one, is help to the nation. In these times of pandemics, we intervene in support of the civilian organization and the civilian healthcare system. Yeah, there are many anecdotes, from the more humoristic to the most horrible. But once I read your questions, I had to remind something what happened in Afghanistan when we were treating our patients, and suddenly we got another patients coming from the other part and from the enemy side. And he was shut down and he needed to be treated, so we reanimated him, we operated him, and we care for this victim. And a few days later we got the visit of his family. And the family was also belonging to the enemy. And they thanked us for having saved their son. That was their last living son, and they thanked us for what we did for. And that's a moment where humanity is taking over enemy feelings. And it was from the humanity side, from a human perspective, something strong, really strong. So I started my career at the age of 15. I was in the Royal Cadet School and I started there as a military student. Then I went to the military school to pass the exams and to get in the Belgian Defense officially as a candidate officer. And I started my study in medicine in the University of Namur for the first 3 years, and then the other years were organized in the Catholic University of Louvain. Then I was sent as a general practitioner in Germany, and I was there the GP of garrison, and I treated militaries and I treated families, and I had a very broad activity in the first line medicine. And then started the operations. In the year 19, we started with a quite huge amount of operations, and there we quite soon remarked that we had to specialize in emergency medicine. So I started emergency medicine and I practiced that in the emergency rooms of several hospitals, and in the Walloon region, in Namur or in Marchand-Famenne, together with my military activity. So we had a normal time in the defense forces, and then also duty period in the emergency medical department, and that was quite nice and clinical side. Then I became a staff officer after a couple of years, and I was also commanding officer of a first-line medical unit. Then I went in a post abroad in an international staff. Then I went back in Belgium, and I was appointed as the director of the military hospital Queen Astrid here in Brussels. And then after a while, after 6 years directing this hospital, I was asked to take the function of Surgeon General and the Commanding General of the medical service in the Belgian Defense. First of all, a military student in medicine will join a great family, a great team. And it's really something which is appreciated also by the members of the family, but also for the people interested in our activities. You will always be coached, you will always be accompanied in the direction you need. If you need support, you will get support from the Belgian Defense, because you are a member of the Belgian Defense as a military student. And as a student officer, you will get several obligations also and opportunities to develop other kind of skills of only studying medicine. Skills in leadership, skills in living on the field, skills in military aspects like shooting and so on. But mainly you will be led to a direction of I need to be a leader and a commanding officer from several teams and medical teams in order to bring and to keep the patient centric of all our activities. Beside the financial aspects, because your study will be paid by Defense and you will be paid as a student officer, beside that you will belong to a great family and you are the most welcome.